to prepare contingency plans in the event of strike action. Patient safety is paramount. NZNO is committed to providing life-preserving services during the days of strike action. NZNO will work with DHBs to negotiate and agree provision of life-preserving services to ensure patient safety. We will be compliant with the Code of Good Faith for the public health sector. Our Health Needs Nursing campaign will continue. During this media conference, an online survey has been sent to all members covered by the DHB MECA. The survey will seek to clarify more specifically the issues that members require to be addressed to settle the DHB MECA dispute. Members will also participate in a campaign where members will share with patients and the public what they want as an outcome to ensure a sustainable New Zealand public health system, one that is safe and of high quality. Thank you.
Thank you, Sis. We will sort of invite you for sort of a brief question and answer session on the announcements that we've just made before I invite our delegates to come and talk to you.
Can I ask, what would it take at this point to avoid strike action?
To avoid strike action, it will take a resolution of the DHB MECA dispute that is satisfactory to our members.
You told RNZ that an immediate increase of 11% was needed to avoid a strike. This apparently equates to about an 18% increase over 2 years. Why is that not enough?
It's not an 18% increase over 2 years.
Sorry, 15%.
And it's not over 2 years. It's actually DHB MECA expired in June 2017. It's over 3 years.
So
and
it's 15% over 3 years.
For registered nurses at the top of the scale. For all our other members covered by the DHB MECA, it is simply a 3% per annum offer.
So is that basically the main problem here, is that it doesn't cover all nurses?
I think what you've heard from both our President and Kai Whakahaere, that it is one of the issues that we are identifying. We need to get more specifics from our members, a much wider voice. These are the sort of initial things that are coming up for us on social media that we're having communicated through our own Facebook medium. And so it is important that we actually try and pin it right down so that we are in a very clear position when we go into further negotiations.
Given you guys have been negotiating for a while now and it's strike action, it's only a couple of weeks away now. I mean, how likely is it that we're going to go ahead with strike action?
Well, we're going to do everything we can, every endeavour to see if we can get an improved offer out of mediation or potentially facilitation. Mediation is our preference. We have an ability, if we can have an improved offer that meets the satisfaction of our bargaining team, to be able to conduct an online ballot in front of the 5th of July. So we will be doing everything we can if that offer is forthcoming and we believe it meets the requirements of our members.
Do you have a figure
feel about strike action?
How do nurses feel about strike action? Well, a very significant number have voted to take strike action. I'm sure there's a range of opinions, just as there would be in any organisation the size of ours in the public sector. But the majority are very clear that they are committed to taking strike action.
Can you tell us the percentage of members who voted to reject this offer?
No, we don't give out percentages of any of our ballots to the general public. But we can say it was an exceptionally high turnout. In fact, I think given the short period that we had, more, that was probably a historical, another high vote for NZNO. So members are very keen to be engaged in this dispute. They are not being passive. They're not sitting on the sidelines. They're right there and they're directing what needs to happen next.
So can you give us a figure for what you're looking for in terms of a percentage increase?
We don't give people figures.
Well, you gave RNZ a figure. You told them 11%.
We talked about the gap between, at that time, I didn't give them a figure of what would settle it, I'll be very clear. We talked about the difference between a secondary teacher and a registered nurse at the top of the scale, and that gap was a gap that equated to 11%.
So you want more than 11%?
Our members will determine what they want, and clearly, as we've said, there are variances in what this offer delivers across our membership. There are large parts of our membership that will not be receiving the 15.9, as we've calculated, percentage that a registered nurse on step 5 might achieve through the settlement over a term of 3 years.
Did more members support this offer though than the previous offer?
I can't comment on that, sorry.
What happens if strikes don't work and changes are made?
What happens if strikes don't work? Well, I imagine that if a strike, when you say doesn't work, members will take strike action. So if members do decide to take that strike action and it's deemed to, it will be successful in its own right as long as members participate. In terms of whether it shifts the government or shifts the employers in terms of an offer, we can only wait and see.
What are you hoping the strike action will achieve then? Because you're going to bargaining now even before the strikes, aren't you? You're going back to mediation now.
I believe that our members, we committed to the ballot on industrial action earlier on. Our members were very clear that they wanted us to take a ballot for industrial action. So those members, we have done that. They wanted it not to delay the independent panel process that we entered into. They wanted that not to delay their ability to take industrial action. Our members are committed to taking industrial action if they cannot get a resolution of their dispute, which they will determine.
So how long do you foresee this going on for? If we have strike action and there's no resolution, there will be more strikes?
I can't comment on that.
You will have another vote though after the strike, is that what you're saying?
We already have notice for 2 industrial actions. So our goal and commitment is to trying to resolve the dispute. As NZNO, we're one party to that dispute. The DHB employers are another. So both parties need to be able to move forward, establish what needs to settle it and make that call.
Okay, so the first strike is in July. Are they both strikes in July? The 5th?
They're a week apart.
Right, okay, and there's no plans after that?
No plans at this stage.
What does urgent mediation look like?
Well, urgent mediation means that the mediation service will make itself available to us as soon as we can, get in a position to meet with them. So we will be hoping that that is either Friday or Monday the following week. If we can do Friday, we would be very pleased about that. That will give us a bigger window to be able to pursue a potential online ballot if there was an offer that was worthy of our members' consideration.
Because when you're looking for the reasons to why nurses reject this, are you now going to be asking
Yes.
members? We'll try to look into that detail.
Members have had a survey sent out to them during this media conference. It's got a 3-day turnaround. We know that members will engage in that process with us. We'll be analysing all of that data. We hope to be in a much stronger position to be able to be clear about what will settle this dispute.
Okay, I will stop questions and answers for CPAIN and invite Grant and Kerry to reintroduce our delegates, and then you can come forward.
Well, the delegates have been introduced. We have Karen from Canterbury District Health Board, or from Christchurch, Freya from Wellington, and Sela from Auckland. And please.
Do you have any questions for our 3 delegates?
Why do you guys think that majority of nurses voted this down?
As it's been previously mentioned in the media many times, that there's been chronic underfunding of the health service across all aspects, including nursing, for at least the last 10 years. Nurses have become passionate about their conditions and retaining nurses in the profession. We've seen a huge loss of valued members of our nursing profession across all aspects of nursing, all occupational groups, leave to go overseas because of the conditions of work and also the pay that is not relative to what we get here in New Zealand compared to particularly Australia. And I believe that as the MECA negotiations have gone on, that nurses are banding together, and I say this across all occupational groups. There's I work both as a registered nurse and a clinical nurse specialist, so I'm in 2 camps. And from one camp it was a better offer, but from the other camp I can see a lot of my senior nurses saying that where's the respect for the value of clinical experience they've got, their knowledge, their skills, their postgraduate qualifications, of our ability to teach and train our younger nurses coming through and to encourage them to come into the profession. And so I think they realise that the time is now to seek a better offer and to protect our public for the future, because if we don't have nurses, even though we're facing industrial action on the 5th of July, if we don't have nurses, the public will be even more at risk than what they will be on the 5th of July whilst we're maintaining those essential services. So it's about being able to provide timely healthcare, and the time for that is now.
I think also quite a large number of nurses were really disheartened in the fact that the latest offer wasn't presented to us through our union, and like C said, in particular the estimated nurse salary was just not realistic for what our nurses will actually be getting, and yeah, that really made it hard for some nurses to look to accept the offer, I think. Yeah.
Sorry. I just think that a lot of nurses are sick of understaffing and poor staffing on the wards. Sometimes you'll come into work and you won't have enough nurses to look after the amount of patients that you need to look after, and that's just been across more than 10 years, even before I was a nurse. And that's something that needs to change, because we can't keep looking after Kiwis, your loved ones, if we're not going to be given the staff that we need to be able to do the work and the job that we studied for. Mm-hmm. Yeah.
Any more questions?
How many members are we talking about here?
27,000 in the DHB.
Yeah.
29,000.
Oh, 29.
29,000.
Keeps going up.
Yeah. We've had a huge influx in nurses that weren't union members that have a standing in solidarity with other union members to become members and to vote in the online industrial action and in person. The effort members made to get to meetings to vote on this offer was phenomenal. They nurses supported each other to release nurses off the ward to go to meetings and have their democratic say on how they felt about the offer.
So all those 29,000 nurses are going to strike on either one of those 2 days?
We can't speak for each individual nurse.
In terms of strike action, what does it mean in terms of 29,000 nurses?
There will be essential services that will have to be provided, and that, as previously mentioned, will be negotiated between the DHBs and the NZNO. And in solidarity, the rest of the nurses will be part of the industrial action. Myself, I will be helping walk the nurses off the floor on the morning of the 5th, if it comes to that. And we've, as you've seen in our Health Needs Nursing campaign, many of you will have seen the rallies that have been throughout the country, and the phenomenal support we had from the public, and even patients within hospitals coming out and being on those picket lines with the nurses was showing that they understood that the conditions that nurses are working in some hospitals.
How has this dispute affected the day-to-day morale and workings within DHBs?
I think there's it's been good. It's nurses are becoming very active and about making their voices heard. it hasn't changed our services at all. Nurses are still coming to work and doing their jobs to 150% every day, but there is strong unity in nurses. We're really committed to standing together and supporting each other to get a deal that we believe shows our worth.
And our other health professional colleagues are in support of us as well. I've had medical staff and allied health staff say that we support what the nurses are doing, and that because they work in the healthcare system as well, and without the nurses they are unable to treat the patients how they want to treat them because of lack of nurses in some areas, and so they're there in solidarity with us as well. So yeah, it's across the health sector that we have support from other professions to take industrial action if that's what it has come to, and that's what our members voted on the online ballot.
Sula, did you want to say something?
Yes, sorry. I can't speak for the whole of New Zealand, but I can only speak for people that I talk with. But nurses are more united together to fight for a better outcome for healthcare of New Zealand. Nurses don't want to strike. We don't want to not give care to your loved ones, but because we want better funding for healthcare in general, that's why we're fighting. Well, not fighting, but wanting to get better staffing so that we can provide better essential services to all of New Zealand. Yeah.
What were your reactions to seeing this revised offer?
Frustration was my first reaction, and that was purely because of the way that it was distributed to us. Like we've said before, that then the $93,000 salary, that was another huge frustration. For a nurse to get that, they'd have to work 40 weekends in the year and overtime and Christmas and all of that jazz. So that was very frustrating, yeah.
I found out from my patients, when I was doing blood pressures. Oh, nurse, you're going to be rich, 93,000, and I was like, oh gosh. Wow. It's just shocking.
One more question?
Is it tough? It's like the third time that DHBs have offered something that's quite low. Is it tough?
For sure.
Yeah,
Definitely.
Yeah. Not a decision that any nurse would take lightly to walk off the ward and leave their patients. And there's been a lot of discussion and passion for nurses that are new into the profession, that don't understand the importance of working together and what it might mean for them in the future. And it's a lot of those nurses actually that are leaving to go overseas because it's more attractive.
Yes.
That they're more freed up than a lot of senior nurses because they don't have mortgages or ties to New Zealand. So, and then it's keeping those senior nurses wanting to still be in the profession. There's a lot with this last offer that said, why would I be a senior nurse when as a registered nurse with that offer I would get more and there'd be less stress. And as a senior nurse, you need to have postgraduate education. You're teaching your junior colleagues, you're going to universities, you're going out to community groups to present, and not having the time to do that because you're being called back on the floor to do work on the floor in many aspects. No one's doing that for you. So yeah, it is not an easy decision for anyone to make.
I think we would love it if we were able to go into negotiations and come out with a fantastic offer that represented our worth. And it has been tough. It has been really hard on nurses, but the fact that we've gotten this far and we're not backing down, we're really making a stand for what we're worth, shows just how important and big of an issue this is. Nurses haven't taken industrial action since 1989, before I was born. And so that's a huge deal.
This would have been This would be my third time of taking industrial action as a nurse, and this time around you can see it's the passion between the occupational groups, the healthcare assistants, the ENs, the registered nurses, the senior nurses and the midwives, community nurses are looking out for each other. This offer was most attractive to the senior registered nursing group that have done more than 5 years of nursing, and they've rejected the offer. So you can see that it's not a solo effort. It is across everyone that have decided to take this action. So that is something.
Why have you taken, sorry, just one question, why have you taken strike action now? It's been 10 years of underfunding. Why didn't you do this under National?
I'll
Any other questions to Memo or C? Would you like to sit down? Thank you very much.
Thanks.
For the last 10 years, we've been highlighting the issue of underfunding with the national government. We have highlighted the issues of safe staffing. So all the concerns that you're hearing here were raised with previous government. And the issue now is pretty much a question of timing. The last negotiations ended in 2015, and at the time, similar sentiments were mentioned, with an indication that at the next bargaining round, most of the issues would be resolved. And the issue is they actually haven't been resolved 3 years later. So in actual fact, the national government didn't resolve the issues.
No, but I mean, have you done it under Labour because you think that they'll be more sympathetic?
I don't think it's about sympathy. It's really the fact that we've had 10 years of underfunding. We've had 3 years of the last settlement, which did not resolve a number of issues related to working conditions and safe staffing.
Can we take questions about the next steps for the meetings and the negotiations? If anyone have any questions about the timeline and how you're going? We're going to wrap up after this slot.
So I was simply just going to conclude. I think you heard from C, and I'll just recap very briefly. You've had the outcome today, which is a strong rejection of the revised DHB maker offer. We will be issuing notices for strike action within the required 14 days, with the intention of the first strike being on the 5th of July, Thursday the 5th of July. Immediately this week, we anticipate that we will go into mediation, and the two parallel processes, that's mediation through IMBI for life-preserving services and essential services and contingency planning. And there's a separate process, mediation and facilitation, to see if we can get around the table with the DHBs to get a resolution to the issues that our colleagues have just outlined. And just in conclusion, you've heard, I think, from our 3 delegates that, as a nursing, we've got, as a profession, nursing has got many different roles. But on situations like this, we speak with one voice and we're one profession. Thank you very much.
Do you want to do one?
VUKA. VUKA. Okay. Okay. Sure. Sure. Oh, okay. Yeah, I've been watching you since I was little. Okay.
Hey guys, sorry, we're just doing it live.
Okay, thank you. All right. Okay. All right. Thank you. Thank you. Thank you. Bye. He's calling me back in 1 minute from a 09 number because the connection's not good. I don't know how to use an iPhone.
That's all right. Oh,
To answer? Just swipe? Okay.
Yeah, there's the
One hand.
it's
I'm a Samsung, that's
literally,
why.
It'll be hang up or answer. It'll be
Oh,
grab
okay.
one. So just you don't need a slide, just hit the thing.
Okay. I'm a
You'll be
Samsung.
fine. Yeah, I know.
Very small time frame in which we have got to
Hello?
offer that would be acceptable to our members to be received by the members so that we could have
Hello. Hi. Hello.
I can't say yes to that because things can move quickly at this time. Our members are very resolved about the industrial action
Yes?
and stand very united together, and so DHBs will need to make it that they further offer a very good offer.
Sure. Sure. SELA.
Absolutely, yeah. No, we're absolutely engaged with the DHBs early on.
IKA. VUKA. Okay, thank you.
No, the majority of members will be taking another election. What we do is negotiate with the DHBs what the specific requirements are. They'll be making plans even now. I think our members have been clear, it's not what news is what to be sure.
Yes.
They really do believe that it's important they make a stand for quality public health care in our country.
No, that's fine. Thank you for talking to me.
Well, they know that if nurses pay isn't right, we're not going to retain nurses.